Have you ever felt constantly worried, stressed, and anxious? That's why we present the ebook Calm Your Mind: 10 Proven Strategies to Conquer Anxiety. With an evidence-based approach and proven strategies, this guide will help you eliminate anxiety symptoms and find emotional balance. And the best part, this guide is easy to understand and implement in your daily routine, so you can start feeling the benefits immediately. Click on the link in the first pinned comment and get immediate access to your ultimate guide to emotional well-being.
What's the best way to manage diabetes? Lowering blood sugar or reducing insulin resistance? First, let's understand what is insulin resistance and its causes. Insulin resistance is a condition in which the body does not respond adequately to the effects of insulin, which is a hormone produced by the pancreas that helps regulate blood sugar. Insulin is responsible for helping cells absorb glucose from the blood so that it can be used as energy. When a person is insulin resistant, cells do not respond adequately to insulin and, consequently, do not absorb glucose from the blood properly. The causes of insulin resistance are complex and have many factors, but some of the main causes include obesity. Excess body fat, especially in the abdominal region, is one of the main causes of insulin resistance. Abdominal fat releases inflammatory substances that can interfere with insulin action. Sedentary lifestyle, lack of physical activity, can also contribute to insulin resistance, as physical exercise helps improve insulin sensitivity. Genetics. Insulin resistance can be influenced by genetic factors and family history. Age. Insulin resistance may increase with age, as insulin sensitivity naturally decreases with aging. Other medical conditions. Insulin resistance may be associated with other medical conditions, such as polycystic ovary syndrome, liver diseases, sleep apnea, and other hormonal disorders. It is important to note that insulin resistance is a significant risk factor for the development of type 2 diabetes and other medical conditions related to elevated blood sugar. Therefore, it is important to prevent or treat insulin resistance through lifestyle changes and, if necessary, proper medical treatments. Now let's understand the importance of lowering blood sugar, also called glycemic control. Maintaining blood sugar at adequate levels is essential for health, as high blood sugar, hyperglycemia, can cause damage to organs and tissues in the body. When blood sugar is high, insulin is produced in greater quantities to try to control it, but if insulin resistance is present, cells cannot properly absorb glucose from the blood. Over time, high blood sugar can damage blood vessels, nerves, eyes, kidneys, and heart. Glycemic control is especially important for people with diabetes, as chronic hyperglycemia can lead to serious complications such as cardiovascular disease, neuropathy, retinopathy, nephropathy, and other microvascular complications. In addition, lowering blood sugar can help prevent or delay the development of diabetes in people with prediabetes or risk factors for diabetes. Keeping blood sugar within a healthy range can also improve energy, mood, and overall quality of life. To lower blood sugar, measures such as a balanced diet, regular physical activity, weight loss, anti-diabetic medications, and in more severe cases, insulin, are recommended. It is important to remember that diabetes treatment and glycemic control maintenance should be personalized and regularly monitored by a healthcare professional. Scientific evidence on the role of insulin resistance and glycemic control in preventing diabetes complications. Scientific evidence indicates that both insulin resistance and glycemic control are important in preventing diabetes complications. Insulin resistance is related to the development of type 2 diabetes and its complications, while adequate glycemic control helps prevent or delay the progression of these complications. Studies show that reducing insulin resistance through lifestyle changes, such as diet and physical exercise, can prevent or delay the development of type 2 diabetes. In addition, adequate glycemic control in people with diabetes can reduce the risk of microvascular complications, such as retinopathy, nephropathy, and neuropathy, as well as macrovascular complications, such as cardiovascular diseases. It is important to note that adequate glycemic control is not the only factor that influences the development of diabetes complications. Other risk factors, such as hypertension, dyslipidemia, smoking, and obesity, should also be considered in the treatment and prevention of these complications. Benefits of addressing both insulin resistance and glycemic control for health. There are several benefits of addressing both insulin resistance and glycemic control for health, such as reducing the risk of cardiovascular diseases and other diabetes complications, as well as improving overall health and increasing quality of life. How to achieve these goals? Balanced diet. A healthy diet, rich in whole foods with low sugar and refined carbohydrates, can help lower blood sugar and decrease insulin resistance. It is important to include sources of protein, healthy fats, and fiber in the diet. Physical exercise. Regular physical activity can improve insulin sensitivity and help lower blood sugar. Exercise can help increase glucose uptake by muscle cells, reducing the need for insulin to control blood sugar. Weight loss. Weight loss can help reduce insulin resistance and improve glycemic control. Weight loss can also help reduce other risk factors for diabetes complications, such as high blood pressure and high cholesterol. Medications. In some cases, medications may be prescribed to help lower blood sugar or improve insulin sensitivity. These medications should be prescribed by a healthcare professional and used with caution to avoid unwanted side effects. Stress management. Stress can increase blood sugar levels and contribute to insulin resistance. The practice of relaxation techniques such as meditation, yoga, or deep breathing can help reduce stress and improve glycemic control. It's important to remember that insulin resistance is a condition that requires medical care and guidance from a healthcare professional. Simple lifestyle changes, such as a healthy and balanced diet and regular physical activity, can help prevent or treat insulin resistance and reduce the risk of associated health problems. However, it's important to consult a doctor before making significant lifestyle changes or starting any treatment. Sign up for our channel and live in focus. Don't miss any of our videos with tips and inspiration for you to live your life to the fullest. Click on subscribe and turn on notifications to stay updated with our new videos.